Hi everyone, today I am gonna present about the cultural sensitivity and awareness in the delivery of healthcare. Cultural competency, or cultural awareness and sensitivity, is defined as the knowledge and interpersonal skills that allow providers to understand, appreciate, and work with individuals from cultures other than their own. It involves an awareness and acceptance of cultural differences, self-awareness, knowledge of a patient's culture, and adaptation of skills. Healthcare is a complex issue. Cultural and language barriers complicate the situation. Cross-cultural circumstances often make difficult to deliver the healthcare to the patients if the physicians fail to understand the individuals from the different culture. With the world population continually growing and the percentage of minorities steadily increasing, the importance of cultural sensitivity is in critical need of attention. There are some culturally defined behaviors that healthcare providers need to learn to deliver the effective healthcare. The first one is personal identity. Within some cultures, people are not defined or named individually. Instead, their names and behaviors relate solely or primarily to their parents, their extended family, or their spouse. Another one is literacy and language. Oral communication is frequently the best way to provide information, whether the client speaks English comfortably or another language. They may not be able to read in any language. When providers sense that this is the case, they can probe gently. For example, would you like me to say that again? I can repeat the information while we go over the pictures, would that be helpful? And decision-making regarding medical screening and intervention may not be decided by the individual in a particular culture, but by the family as a whole. This means that the patient may not be in a position to give consent while in the doctor's office, instead returning home, discussing the matter, and calling back another day. The healthcare provider must be ready to observe and learn what makes people uncomfortable. Respect for authority. For some ethnic groups, their public etiquette may prevent a person from raising questions because to do so implies doubt in the doctor's opinion or knowledge. Thus the patient may make an effort to please the healthcare provider rather than explore the medical situation as the provider's partner in the treatment. In this case, even they have doubt and want to know more about instructions and treatments, they will simply say yes and don't practice according to the instruction. Appropriate versus inappropriate questions. Culture, religion, and direct personal experience tend to determine the types of questions that an individual feels are prying, too personal, and even unsafe. For example, to discuss income may be considered boasting and therefore impolite. For other people, it may be shameful if they are poor. Religion may place strict limits on discussion of sexual practices. Perhaps it is only permissible woman to woman and man to man. And those who have lived for any length of time under dictatorship may worry that the health center will know too much about them, something that was very risky in their past. So assure the patient that all the information of the patient are confidential and only used for the medical purpose. Silence. Some cultures view silence as awkward, however others are quite comfortable with periods of silence. Distance. The most comfortable physical distance between two people varies according to culture. Eye contact. The amount of eye contact that is comfortable varies with each culture. Some are comfortable with looking people straight in the eye, others have been taught not to make eye contact. Body language. The position, gestures, and motion of the body can be interpreted differently depending on culture. The use of hands is a common vehicle for nonverbal expression. A firm handshake may be a positive gesture of goodwill in some cultures while others prefer only a light touch or no handshake at all. The following are some examples of the culturally sensitivity in practice. The first case is a 30-year-old physician enters the examination room to see his next patient, who is a 50-year-old African American woman. He introduces himself, addresses her by her first name, and asks why she has come to the office today. The patient becomes visually upset and gets up to leave. She tells the office staff as she leaves that she will never return to that doctor. For this, clinicians need to aware that addressing patients by their first names may be perceived as disrespectful, especially for certain minority groups. So, What we can do is ask every patient an open-ended question about how she would like to be addressed, Miss, Mrs., Drive, and Professor, by the healthcare provider. And noted in the medical record to remind everyone how she wishes to be addressed. Another scenario is an elderly Chinese woman is asked by her physician to go to the laboratory to have blood drawn for tests. She takes the laboratory slip but does not get the tests, nor does she return to see that physician. In this case, if the physician notices the woman's hesitation when she is being told to go to the lab, asks her why she is worried, so she can tell her concern about her belief on the withdrawing the blood such as it might can weak her. So the physician can explain in how blood is replaced and the importance of the tests. As can be seen from the preceding examples, not all cultural competency issues relate to foreign languages or cultures. Cultural competency encompasses gender, sexual orientation, socioeconomic status, faith, profession, tastes, disability, age, as well as race and ethnicity. Physicians should be sensitive to the unique needs of people in the communities they serve. These are the references for theses slides.